All right, so we're back, and we've received orders to give this patient an NG tube. We're going to apply suction, intermittent suction is why we're NG tubing him. What we want to do is come in here and do the meet and the greet. We're going to do the two patient identifiers. Name, date of birth, please. And he's Mr. Rothson. He is who he is. Very good, very good. Okay, so what we're going to do is we're going to move him into the high Fowler's position. So we're moving in high Fowler's position. I'm going to take our NG tube. Okay, here we go. Now we need to measure our NG tube. I'm going to go from the nose to the around the ear to the xiphoid process. There's that. Right, to the xiphoid process, I'm going to mark that with a piece of tape.
Withdrawal 2 milligrams, and I'm going to administer
Some tape.
All right, first I'm going to begin by labeling.
All right, we're going to put a little towel here across him just in case we get a little messy. Very good. All right, I have prepared a little cup of water for him so he can swallow when we're inserting the tube. All right, I'm going to put on some gloves. I'm going to take the NG tube, insertion tube. I'm going to lubricate about 4 or 5 inches at the tip, just to kind of help it go down, lube, 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 lube. So there we go. All right, now I've explained to him what we're going to do, and he's had this process before. He didn't like it, but that's why he's familiar with it. So, so here we go. So what I need to do is I need to decide which nair to go into. So I'm going to do that yet. So we would assess his nairs. What I'm looking for is a deviated septum with a pin light, deviated septum. I want to include one nair, breathe for me in and out through your nose. And so we want to make a decision, intelligent decision of what nair we're going to use for the procedure. Then we would have taken our tube and we would have lubricated it, the end 4 to 5 inches. Okay, here we go. And I'm going to go through the right nair. What we're going to do is we're going to ask him, keep it handy, we need it back in a minute. I'm going to need to ask you to tilt your head back a little bit and try to relax for me if you can. All right, here we're going to begin. Insert, insert, insert. Now, toward the rear pharynx, I want to, with my pin light, inspect, just make sure that the tube is not coiling up in his throat, and we're not, we passed. Okay, I'll tell you what, now as we continue, I want you to hold, my magic hand is going to hold that as we tilt his head forward. Chin to chest, there you go. Now there's my magic hand is going to give him a little sippy word. Now swallow, and as he swallows, we're going to advance the tubing in. We're going to advance. If he has cough and choking, if he had any issues, we can withdraw a bit. Let him rest a little bit, but he's taking it okay. So we're going to advance until our tape hits. Boom. So we've hit our limit. I'm going to have magic back. All right, we're going to take our 60 milliliter syringe. We're going to take our 60 milliliter syringe, stick it here. Now what I'm going to do is I'm going to aspirate for stomach contents. I'm going to aspirate, and look at that, I got some stomach contents back. Okay, so here's what we're going to do. I'm going to disconnect. We're going to put a little bit of the stomach contents into a little cup. We're going to take our little pH paper. We're going to test it because we're expecting a response back. Let that dry there for a second. We're expecting a response back that says, yeah, that was the stomach, most likely. And we got the color indicator that we wanted, suggesting that it is the stomach. So at this point, as I reinstill my stomach contents, I want to listen to me at the gastric area. Okay, so here we go. So we're going to reintroduce the contents, and we're listening. I don't hear anything, and we're listening. And there you go. We have a little swirl, a little swish, a little swirl. There you go. And if we'd inject the air, we'd hear some gurgling, gurgling, gurgling. Very good. Okay. Now at this point, disconnect. We want to suck up 30 milliliters of saline or water. I'm going to suck up just normal water. All right. Sucked up 30 milliliters of water. And then we will introduce it. Okay, and we introduced 30 milliliters successfully, no issues. I'm going to withdraw. What I'm looking for, I want 30 milliliters back. If I don't get all 30 milliliters, I can reintroduce, try it again, pull back until I get 30 milliliters, and look at that, we successfully got our 30 milliliters back, and a little bit more, got a little bit of stomach contents, and now we're just getting air. So we will disconnect. I'm going to sit this here temporarily. I'm going to take my NG tube. I'm going to apply it to the suction. Okay. We're going to set the machine to intermittent suction. So we're intermittent suction. I'm going to take my rubber band and my clothespin. Oh, there it is. A rubber band around there, a little slip knot. I'm going to clothespin this here to his little gown with enough room to where he can tilt his head, move all around, and he won't tug on his NG tube. I'm going to take our little strip of tape. There we go. Here we go. No. We're going to lock. Oh, get back in there. I'm going to lock him in there. I'm going to lock him in there. There you go. You look good. Okay, and we did apply the suction. Now, I'm going to check with him that that he's doing well. Okay, that he's not choking. Additionally, we could send him for an X-ray just to verify that the placement of the NG tube is truly in his stomach, not into one of his lungs. We also should have asked him to speak to us, or I could have just been speaking to him. How you doing? And his response would have been a verification or suggestion that we did have correct placement. With that being said and done, I'm going to lower him down so he's not so awkwardly up there. Now, we'll take the stomach contents, and we want to pay attention to how much of the stomach contents we did get out. We're going to want to annotate, we're going to want to document that as we complete our medical records for this patient. And we're going to want to mention, the amount of contents that we did withdraw. We're going to want to mention the pH of it, the consistency, the color of it. And we'd probably honestly be seeing a little bit of a solution in the intermittent suction vial by now. I suppose depending upon his stomach contents. That being said and done, we're going to check him out, make sure he's okay, he's comfortable, you know, all the 5 P's, and we're going to make our exit. That's it.